In 1971, in the summer of 1971, a group of students and community workers organized a health fair in Chinatown. And the theme of the health fair was to bring the exam room to the community. After the health fair, the man who was actually one of the leaders of organizing the health fair, his name was Thomas Tam. So Tom was the one who said, we need to do more than a one-time screening event. Why don't we organize a free clinic?
When the clinic was first started, it was held in a church basement in Chinatown. Over time, it's grown to become a federally qualified community health center with multiple locations. It's nationally recognized, and it serves tens of thousands of patients a year.
I was born in Hong Kong, December 1950. I came to the United States when I was 8 years old. Chinatown at that time was very, very small. It was maybe 7 or 8 blocks. So it almost had a feeling of living in a small village in China.
In the late 19th century, when Chinese were essentially pushed out of many jobs because of exclusion laws, because of racism, many went to New York's Chinatown. And then they slowly, over time, began to settle in Lower Manhattan, where they formed what were ethnic enclaves and what we now know as a Chinatown, right? And these Chinatowns provided not only kind of social support amongst people who shared similar regional or district affiliations, they also provided a sense of protection from hostility from mainstream society. Because this is also a time in which there was a lot of anti-Chinese sentiment and a growing anti-Chinese movement.
So I grew up with my father talking about issues in the community and talking about the fact that we Chinese people really need to help ourselves.
The moral core of philanthropy is reducing inequality. Regina grew up hearing her father speak about providing services to the community. Her dedication to community service grows from those influences.
By the time I got to NYU, the Chinatown has really grown. It was in the 70s. At that time, it was the beginning of a free clinic movement. The Haight-Ashbury Free Clinic was based in Berkeley, California. And the concept of a free community clinic began to evolve.
In addition to the free clinics that were being founded in California, African American activists and their white allies in the South had established a community health center in Mound Bayou, Mississippi, and another was established in Boston. Those institutions were the first of what's become the community health center movement in the United States.
I would say when I started in 1971 with the health fair, and even when I was volunteering in the Chinatown Health Clinic in the 70s, I don't think that I had a vision that we will become what we are today. A nationally recognized national quality leader in delivering healthcare to underserved populations, particularly Asian Americans.